Hello everybody. I have not made a video like this in a little bit, quite some time. And what I wanted to do while I had a minute was just address some of the weird misconceptions I think that are around not just chiropractic, but natural health and wellness, back pain, neck pain, physical pain, and the reasons we have it, what it means, what works, what doesn't work. So I'm going to make this as short as I can, and I know I have a tendency to ramble on and make long videos. But here's what you have to understand. If you say have spinal pain, much of the time, like a lot of the time, big percentage here we're talking, there's a disc-related injury. It is a disc-related injury. And now I'm going to show you a model, okay? So one take, here we go. Now, this does not mean it's all the time, but it means a big percentage of the time. So likely the back pain, especially lower back pain that you're having, or neck pain, certainly one where the neck pain goes into the shoulder and down the arm, or you have any weird feeling in your shoulder, your arm, your forearm, your hand, your fingers, they're always going to be, or a lot of the time, going to be related to like a disc. See, here's a bone, a disc, and a bone, and there's the nerve root in the middle. And you can appreciate that the mechanics here are going into flexion and extension. And whenever this bone that can either go in lateral flexion and rotation, when they get an injury, and there's always a mechanism of injury at some point, whether it's a tackle football injury, you fell off your bike injury, you fell down the stairs injury, your mom dropped you when you were little injury, you see where I'm going with that? Some kind of an injury ends up leaving this joint compromised and the body's trying to protect it. And what happens is anything beyond anatomical integrity to take these little diagonal or oblique angled fibers, they're called annular fibers. Whenever those fibers, you see them here better up top with the light, when they tear just a little bit of tearing, it aggravates the capsule, and especially in the back and on the sides, you can see how that would impact the nerve root. And yup, that nerve root is what controls everything that goes down through the butt, down the thighs, the legs, whatever, down to the toes, ankle, foot, everything. Plantar fasciitis, bursitis, ankle sprains, and various other injuries. It's all connected. The fascia that runs across our muscles or over our muscles gets distorted, and it starts tugging and pulling, and all these bad things happen. Now, here's what I want you to understand. I recently watched a video and somebody said decompression doesn't work, and I'm going to explain why. And the moral of their story was that decompression doesn't work because it gives temporary relief. Okay. Yeah, decompression does work because it gives temporary relief. How and why does it work? Does it give temporary relief? Well, again, here we go. Here's your bones in your disc, and watch what happens. And it decompresses, temporarily relieving the pressure, hopefully enough off the nerve root that if we can get that capsule to open, gives just enough of just enough of pressure release that maybe it changes the pressure gradient that's within there to feel like it's not so compressed and allows it to heal a little bit. There's also this thing called ambibition, I believe. Is it imbibition or ambibition? Somebody out there will correct me or not. And that pumping mechanism in the disc to bring the fluid, which is nutrients, to the disc to begin to feed it and nourish it and allow it to heal. So other people will say, that I'm not doing the purest form of chiropractic, and this is not about defending myself here, just education. When I do decompression, or why the adjustment should alone work, or something crazy like that. Well, here's the deal. For every 100 patients that walk through my door, I would say between 3 to 5, maybe maximum 5 out of 100 use decompression. The maximum amount of visits that 1 in 5 of those, or 1 in 4 of those people will use is probably about 5 visits of decompression. And then we take them off decompression. Do you know why? Because decompression does work to give you temporary relief. But the only way you get a joint stronger, better, feeling better, change the perception in the brain down the spine to the extremity or to the spinal joint. The only way you change the perception of pain is by compression and motion, not decompression and motion, but by compression and motion. Compression and motion is a beautiful thing. We have to live in a compressed state. As we walk, as we sit, as we maneuver our bodies and load our bodies, as we lift, as we bend, as we move, we are compressing our joints. It's compression and motion. If you can't tolerate that, then you're never going to get better. So think of it like this, whether it's decompression, whether it's the chiropractic adjustment, whether it's a combination of them, whether it's weightlifting, whether it's physical therapy, rehab, stretching, whatever it is, there has to be a certain amount of progressive loading in every direction or in in every which way we just talked about those modalities. Because only then can you get the longevity, the sustainability, and the actual fixed a back or spinal pain to go away that you're looking for. So that's the key to remember. There's a time and a place for a lot of things, but the most consistent thing that you're going to need, and yes, this is why the adjustment is so effective and so powerful, and don't you forget it, and why lifting weights and doing things like picking up kettlebells and functional movement works. It's because because loading the joint, compression and motion, biomechanically correct. It builds stability, it increases mobility while building stability. And the way you can get the strongest, the fastest, is a healthy spine that doesn't perceive everything as painful, can then do loading through motion. That's my big shout out to the knees over toes guy that sort of started bringing this to light, is loading through motion. Which, why do you think chiropractic and especially the Gonstead method works so well? Because it's about P to A motion, biomechanically correct P to A motion. So it's compression and motion through the table. But that doesn't mean that decompression doesn't work, because you bet your ass it does. Especially for radicular pain going down the arms and legs, especially as a temporary pain relieving fix. Just like oftentimes the chiropractic adjustment is a temporary pain relieving fix. But everybody's different, and that's for another podcast, that's for another video. Guys, see, I went on longer than I wanted to, but I hope I provided you with some wonderful, great, needed information. And until next time, feel free to reach out. This is Dr. Pearlman.